Hey guys, I have 5 exercises for you guys to help decrease your risk of falls, decrease your rate of falls, and increase your balance. My name is Dr. Chris. I've been a physiotherapist for 10 years, and these exercises, all you need is a chair. Now, obviously, judging by what balance you have, whether you have really good balance, really poor balance, or anywhere in the mix, these exercises might not be exactly what you need, but I think anyone can use the chair and the brain and the comment section, and we get you a better balance. So the first thing we want is a chair. We want you standing tall. We want a chair with no wheels on the bottom. The wheels have a tendency to roll away. So get a chair or a countertop or a wall. It's not going to move. And start with me. So we're going to just have you here. You have your hands on it, and gently take your leg out to your side and back. We're going to do about 10 to 20 of these. Slowly, not quickly. I know you can do it quickly. That doesn't impress me. To impress your balance, you got to have it nice and tall. So, if this is easy, you have your hands floating on the chair. If this is harder, you can have a lot more weight on your chair. When you're doing this exercise with your leg out to the side, what we're looking for is nothing to move but that leg. I don't want to see a lot of this. I don't want to see anything like that. Tall top half with that leg moving. Slowly back and slowly forth. We do it with the right leg, we do it with the left leg. And again, try to be tall. If done correctly, you'll feel this kind of in your hip, maybe in your ankle, and you might struggle a little bit if you have issues with falling, a little bit loss of balance. The next exercise we're going to do, use a chair, or as I said, a countertop, and slowly march. This is going to be a lot harder for some, not that hard for others. But again, if it's not that hard, float your hands up there. If it is that hard, keep your hands on the chair. We're going to march 10, 20 times. Again, we're trying to do this all within 5 minutes. When we're doing this with the marching, again, we're trying not to have too much top motion. We're trying to make sure it's all coming from the legs. If there is top motion, that's fine. Just keep that in mind of what the target is. Exercise 2. Third exercise. Standing with your feet heel to toe, one foot in front of the other. Standing there like this. And again, if this is very hard to get to, keep your hands on that chair and try to keep yourself upright. If this is easy, take one hand off, maybe keep a finger on, or if you have both hands, just gently floating. The last thing I want you to do is put your hands to your side or do this on the side of the room. Terrible idea. I want to be sure you're right in front of that chair. So if you need balance, it's there. We'll do it with the right foot in front. Set a timer, maybe a minute timer on your phone. 1 minute of struggle in here. I don't care if you use this chair like 4 or 5 times, but if you practice here for a minute total with the right foot in front, and then you practice here for a minute total with that left foot in front, struggling with the balance, you're going to improve balance if you do this daily. The next exercise, stand with your feet together. You'll stand with the chair right here. Again, this is going to start feeling easier at the very beginning. You're going to be like, Chris, if I can stand with my feet heel to toe, why would I bother standing with my feet together like this? I'll tell you. Stand here. Hands on the chair, floating on the chair, finger on the chair. We talked about this. And slowly turn your head left to right. Now, if you do this, some of you will notice how it starts throwing off your balance. Get hold of the chair. The last thing we want to do is fall. I always tell my patients, fall is a 4-letter word beginning with F. We don't do that. So we'll be up here. We'll do your head left and right. About 30 head turns, and then head up and down. And sometimes when people look up, they start losing their balance back. Keep your hand on the chair if that's the case. And then the last exercise that we have is standing feet shoulder distance apart. You're going to come up on your toes, slowly. You're going to come back on your heels. Up on your toes, back on your heels. Please keep your hand on the chair, or again, very close to it. Especially when you go back on your heels. Some people struggle. Alright, there it is. 5 exercises that you can do probably within 5 minutes that if you do daily will help increase your balance. When we do this, Chris, highly recommend turn on the coffee pot do some exercises. Because I personally, when I turn on my coffee pot, I'm just kind of looking at it, waiting for the coffee to drip, or pull up my phone. Why not improve your balance? And my name's Dr. Chris, physiotherapist. Like these videos, please like, subscribe. It's going to help a lot. I have a really small channel right now, but I'm going to start releasing more videos on the topic of balance, on the topic of decreasing falls, on the topic of improving your balance. And if you comment, I promise I'll read them. Have a good one.